Hello, everybody. We'll just give it a few minutes while everybody gets into the webinar for today. So as we're waiting, just wanted to remind everybody that if you have any questions, to please type it in the chat box, and we will read those out towards the end of today's session. We'll just give it a little bit more time, and then we'll get started here in just a minute. Well, I think we can get started. I'd like to thank everybody for joining us. This is our Medicaid and Waiver Programs webinar. My name is Richard Maxey. I'm the Family and Caregiver Coordinator at DSF. And today we'll be joined by Amy Aikins, the Director of Patient Access for the Little Hercules Foundation. And I'd like to take a moment to thank our sponsors, Biocodex, Jazz Pharmaceuticals, Takeda, and UCB for their ongoing support and sponsorship of this educational webinar series. This session, along with the slide deck, will be recorded and available on demand. We ask that all attendees remain muted with their videos turned off during the presentation. There will be time for Q&A at the end, so we will get to those questions, but just type in your questions that you have in the chat box, and we will read them at the end. I'd like to introduce today's presenter, Amy Aikins. Amy has many years of experience working in various capacities within both public and private nonprofit organizations focused on serving individuals with disabilities. She has passion for helping people obtain access to the things they need and extensive experience with coordinating community supports, locating and arranging necessary paid services, and navigating public benefits. She currently works as the Director of Patient Access at Little Hercules Foundation, a nonprofit organization based in Columbus, Ohio, that has focus on serving Duchenne muscular dystrophy and greater rare disease community. She is also a mother to a 19-year-old son with Duchenne. In her current work role, Amy tackles access issues through engagement with stakeholders and involvement in various groups and projects focused on access issues within the rare disease community. She also works directly with individuals and families to address individual access concerns. So, Amy, welcome.
Thanks, Rich. I'm glad to be here.
And I will give it to you, Amy. So go ahead and take it from here.
All right, I'll load up my slides. Can everybody see my screen? Oh, it says it's loading. Can you see my screen?
No, not yet.
Oh no. I'm gonna try to implement a new share and see what happens.
There we go.
All right.
Sorry for
Well,
that.
I got a little scared there.
Okay.
Okay. Well, thank you all for coming to this presentation, and thank you for that great introduction, Rich. As he said, my name is Amy Aikins, and I am Director of Patient Access at the Little Hercules Foundation. And while we chiefly work with Duchenne muscular dystrophy community, we also work with the greater rare disease community on concerns related to access to treatment. So the focus of today's presentation is Medicaid and important information for families to know. I'm going to begin by talking about some ways families might be able to access Medicaid coverage for their child with significant needs when the family doesn't meet the financial qualifiers of obtaining Medicaid traditionally. Then talk a bit about the home and community-based Medicaid waivers and give some tips on working within those programs for those who may already be enrolled. And then I'll briefly go over the Medicaid denials process. And lastly, I'll present some resources on how you might learn more or obtain direct assistance. At the end, there should be plenty of time for questions. So please feel free, as Rich said, to either make a note in the chat box or make a personal note, and then we can go over questions during the Q&A period. Just a short disclaimer that this is for informational purposes. It's not medical or legal advice. And also, while I'm an employee of the foundation, a Little Hercules Foundation, if I express any opinions here, they're mine and mine alone, and they don't necessarily reflect the views of the foundation that I work for. Just getting that out of the way. So what is Medicaid? Medicaid is one of the largest health insurance programs in the country. Per Medicaid.gov, 84.3 million people are covered under Medicaid or CHIP, and that's based on the July 2023 Medicaid enrollment report. Medicaid is run by states and the local government according to federal guidelines. And often Medicaid is confused with Medicare, and they're not the same. Medicare is the federal program that covers the elderly and certain disabled people. Some states offer Medicaid through managed care plans, which operate similarly to commercial insurance, while others offer what we refer to as fee-for-service Medicaid coverage. Basically, this means that the state is operating the program without using a managed care plan. Some states offer coverage both ways, and the options for how an individual gets coverage is based on what made them eligible for Medicaid in the first place. So Medicaid provides coverage to certain populations, specifically coverage to eligible low-income adults and children, pregnant women, and people with disabilities. There are multiple ways to qualify, and I will talk about them in a bit. And also, there are benefits of having Medicaid coverage in addition to commercial coverage. mainly the benefits of that Medicaid can help meet the annual deductible for commercial coverage, as well as also help with paying those co-payments and the co-insurance. It also might cover things that commercial coverage doesn't, such as certain medications or ongoing therapies and in-home care. Families can also get assistance paying for their own insurance premiums through Medicaid in some circumstances. Medicaid has benefits that they have to cover, and these are just some examples. The list is actually much, much longer, but just some examples of those mandatory things that they have to cover would be hospital services, your home health care, physician services, lab and x-rays. And in addition to the mandatory benefits that they have to cover, there are also some optional benefits that Medicaid can choose to cover. And this is, once again, just a really short list, but just for an example, dental coverage, not something that has to be covered, but some are covering, eyeglasses, and community-based services. And now, for children who are enrolled in Medicaid, coverage is enhanced. And that's due to something we refer to as the EPSDT mandate. And what that EPSDT stands for is early and periodic screening, diagnosis, and treatment. So under this mandate, children who are under age 21 and enrolled in Medicaid get more comprehensive benefits beyond what the regular traditional state plan would have offered. And states have to are required to provide these services, and they have to furnish all Medicaid coverable, appropriate, and medically necessary services. And that would be all services needed to correct and ameliorate health conditions, which basically means make the condition better or more bearable. And this coverage is based on certain federal guidelines. So just an example of an enhanced coverage for children might be physical therapy. Maybe the Medicaid plan normally caps annual visits to 15 visits a year, just as an example. But there's a child who needs physical therapy twice a week for the entire year. Under EPSDT, they would be covered for that entire year and not have to be bound to the 15 visit cap. If that makes sense. So in addition to, financial qualifiers, there are some ways children who have disabilities and are, medically complex could qualify for Medicaid, and I'm going to go over those next. The first of which is something called TEFRA or Katie Beckett programs. And these programs are for children who require a lot of medical care, who have family income that's too high to qualify for Medicaid traditionally. A little bit about the Katie Beckett is this originated in the early 1980s. And it started when a girl whose name was Katie Beckett had her parents who fought to overturn a Medicaid regulation that would have forced little Katie to live in a facility instead of home with her family. So she had been hospitalized for many, many years due to encephalitis, but eventually her doctors determined she could be treated at home, but she needed to have the right supports. But at that time, Medicaid would only cover institution-based treatment, even though the cost of that treatment in an institution would actually have been 6 times what it would cost to serve Miss Katie at home. If she came home, her parent income would have been considered, and she wouldn't have been able to qualify for Medicaid to get services in the home. Katie's mother argued this was a bad policy, because, a really bad policy. But the story eventually reached President Reagan, and he agreed, and he waived the rule on a one-time basis, letting Katie be able to be served at home. Later, Congress passed the Katie Beckett waiver, and this waiver made it possible for states to offer this option of coverage to create an additional pathway to Medicaid for children birth up to age of 19 who have family incomes that are too high to qualify for Medicaid and whose medical, mental, and emotional health needs are described by the childhood listing of impairments on the Social Security website, or they meet the criteria of being disabled. and they also have to require an institutional level of care. Basically, what institutional level of care means is that the person could qualify to live in an institution, but they're being cared for at home. And this determination is based on the person's functional levels and needs. TAFRA programs are offered in multiple states. 24 at this time offer this program, and there are also a few other states who offer similar programs. And then lastly, these programs don't have a waiting list. So if the child meets the qualifiers and they have the program, they can be enrolled. Another way is through supplemental security income, also known as SSI, which you may have heard of. SSI is designed to help aged, blind, and people who are disabled who have little or no income. It provides cash to meet basic needs for food, clothing, and shelter. And children may also be eligible for SSI if they meet certain conditions. So here's the conditions. They have to meet the standards of being disabled per the Social Security Administration. And those standards are, first, that the child has to have a physical or mental condition that very seriously limits his or her activities. The conditions also must have lasted or be expected to last at least 1 year or result in death. But Social Security also has a list called the Compassionate Allowance. And those are a way that they are able to quickly identify diseases and other medical conditions that by definition meet Social Security standards for benefits. And I did see that Dravet syndrome is listed as a listed condition. And lastly, they must be low income. So family, household, and incomes are considered in the determination, and that's through a process called deeming, which means a portion of the family income is considered to be available for the child. SSI may equal Medicaid eligibility. In most cases, it absolutely does. So in most states, people who receive SSI qualify automatically for Medicaid with no need to apply separately for it. In some other states, SSI guarantees you eligibility, but the person still needs to file an application with Medicaid. And then in a few other states, SSI does not guarantee Medicaid eligibility, but most people who get SSI are still eligible in those states as well. So for the most part, SSI equals obtaining Medicaid. Another option for families are medically needy or buy-in programs. And there are multiple programs and pathways. One of those is that a person can be above the income level to qualify traditionally for Medicaid, but the state might have a higher medically needy income limit. So that's, pretty easy to understand. Another way is a spend down to eligibility. And basically what this means is a person can qualify for Medicaid by spending down. This means that once an amount of medical expenses are incurred, those expenses are then subtracted from the amount of income that they are over for qualifying for Medicaid. Once enough expenses occur, then the person becomes eligible for Medicaid. And then another option would be buy-in, and I have seen this in a couple of states. So in these programs, children have to meet the SSI medical disability criteria, but they can have family income up to 300% federal poverty limits. In these programs, the state is able to charge up to 5% of the family's gross income for the child to have the coverage. And while it's not really the focus of this presentation, there are programs where adults who are disabled can also buy into Medicaid at a low cost. Another way is Medicaid waiver programs. So in simple terms, in a Medicaid waiver, the federal government permits a Medicaid program to waive certain rules and regulations. And that's where we get the name waiver. There are multiple types of Medicaid waivers, but all of them fall under sections 1115 and or 1915 of the Social Security Act. Medicaid applies for waivers for a variety of reasons, mainly to expand coverage to certain groups of people, to lower costs, or to improve care. They're most often helpful by expanding or enhancing coverage for individuals. And I'm going to concentrate the waiver portion of the presentation on these programs that are helpful. But I do feel like I need to mention that a waiver is not necessarily always a good thing for patients. So you might have heard those things in the news recently, maybe within the last year or two. There are some states who've either applied for or considered applying for waivers to do things like restrict coverage of certain treatments or implement work requirements. And then another really common way that children with disabilities obtain Medicaid is through home and community-based waivers, or HCBS. Home and community-based waivers first became available in 1983. At that time, Congress added 1915C to the Social Security Act. This section gave states the option to receive a waiver of Medicaid rules surrounding institutional care. Services are provided in the home or the community instead of being provided in an institution, such as a nursing home. Like in TEFR programs, individuals have to meet this level of care requirement for enrollment in a waiver. And it really depends on the waiver, what level of care is required. So some examples would be nursing facility as an example, or an intermediate care facility for those with intellectual disabilities, which is also known as an ICF-ID. Enrollment can be a means to obtaining Medicaid. While some waivers do require that a person already be Medicaid eligible to qualify, in many cases, when making waiver determinations for children, only the child's income and assets are considered for eligibility and not the parents. This makes HCBS waiver often a route to getting Medicaid coverage. And they offer services that are not necessarily included in the state plan. Those would be things like your respite programs, your daily living skills programs, community integration support, home modifications. The availability and the service offerings do vary by state and also by waiver program. So other things to know about HCBS waiver programs. First of all, different waivers often fall under different departments. So sometimes it can be difficult to navigate locating, how to even apply for a waiver. So for example, some might fall under the Department of Health in a state, another, the Elder Affairs or the Aging Office, believe it or not, and another, the Developmental Disabilities Office. Each one of these waivers and each office could have completely different ways of managing screening for eligibility and also the enrollment process. Also, services offerings and their names vary. So, for example, home modifications might also be called environmental accessibility adaptations. Next, a caseworker is typically assigned to assist with needs. So this support's very helpful as needs arise. A caseworker can be instrumental in helping to locate and coordinate necessary services and supports. And lastly, waitlists are permitted. They can and do exist, as HCBS waiver programs are not entitlement programs like Medicaid itself. How these wait lists are managed also vary. So sometimes you call a phone number and you're on a list, and when your name comes up, they call you or you get a letter in the mail. Sometimes it's based on need. So is there an emergent need where, a child would need to be enrolled now in a waiver? Or are we planning for something, down the line? And in other places, sometimes it's just a substantial wait list. It can be to the tune of several years or more. So it's really determined by where you live and sometimes where you live within a state. For those that are already enrolled in one of these waiver programs, because I realize they are, pretty popular. So, I may have some folks on the phone who are enrolled already. These are just some tips. First, know what services are available in the waiver that you're enrolled. And if if you don't know, or that your child's enrolled rather. And if you don't know, ask your caseworker or the service coordinator to provide you with that information. Next, know your appeal rights. As these are Medicaid programs, people that are enrolled do have appeal rights. Know these rights and use them if they're needed. Next, don't be afraid to ask questions. If you aren't confident in an answer that you receive, don't be afraid to ask additional questions. Keep the caseworker apprised of needs and service satisfaction issues. So if you have a new need, make sure your caseworker is aware of it. It could be something that the waiver provides, or perhaps your caseworker might know of some resources in the community that can help. Some community programs might require that a professional make a referral to their program if it's, you know, a community program and not a waiver program. So if you don't ask your caseworker, you might not ever find out about them. And if you are going to be getting a service, find out what you need to do in order to obtain the service. For example, some services might require a doctor's prescription, denials from your insurance company, and/or Medicaid, or you might need to get multiple quotes. In some cases, there's a list of contracted providers for the service that you need to choose from. I have known parents that have gotten quotes from contractors only to be told they couldn't be used for the service because they weren't contracted with that particular waiver program. And that can be really frustrating, you know, as a family, to work really hard to get, you know, to get these quotes and then be told that we can't use any of them. If you do have some services and you're not satisfied with them, you can talk to your caseworker about it. It's likely there's a way to work toward a solution, and if not, there could be another provider that may be able to be used. If you don't feel your caseworker is providing the support that is needed, don't be afraid to contact supervisory staff. I had a dear friend whose son was not getting a home modification they desperately needed, and her son's caseworker was just not doing what he could do to make this happen. I advised her several times. I said, please contact the supervisor. But, you know, like many of us, she was afraid to ruffle some feathers and, you know, didn't want to get on anybody's bad side or get anyone in trouble. But eventually, you know, as time went on, the need still wasn't being met. So she finally did call and got what was needed within a very short period of time. So definitely, if you're not making any progress getting some changes made, or if you're not happy with the service you're receiving from your caseworker, you can go above them. So this is outside of home and community-based waivers. As I mentioned earlier, under optional coverage, Medicaid can offer some home and community-based services. And so these are just 3 of the services that they can offer. Outside of a Medicaid waiver, that would be your state plan home and community-based services. So in this instance, people have to meet a state identified criteria, like being a part of a certain population or have a certain need. People are enrolled in these programs and they get a combination of medical services like skilled nursing, as well as long-term services like case management and home modifications. And these are in the home and community-based setting. The next is self-directed personal assistance service. And in this program, personal care and related services are provided under the Medicaid and the home or the home and community-based waivers that are already in place. So participants in this program, or parents in this case, hire, train, and determine the pay for their own staff. And then the last is program that many states do not have. There's very, very few states that offer this, but I'm mentioning it, called Community First Choice. And this is where states provide attendant care within the state plan. And again, it is not a common program. For those that are enrolled in Medicaid already, or when you're trying to be enrolled, there are 3 decisions that can be appealed. So the first is eligibility determination and decisions. So that would be, are you eligible for Medicaid or not? Coverage decisions under a fee for service. So that would be the state's managing the program, or decisions that are made by a managed care health plan. So that would be your managed care under Medicaid. And just a reminder, I mentioned earlier, the waiver programs are Medicaid programs. So they do have an appeals process, but the process of appeals may differ somewhat from the process for Medicaid itself. So if you receive a notice of denial, the first thing you want to do is review it. If the service is something that's existing, for example, you have in-home nursing, and the determination is a reduction in hours or a termination, a 10-day notice has to be given prior to the change. If you request an appeal prior to the end of this 10 days, you should have the option to continue the services until you receive a decision on the appeal. Carefully review the reasons in the denial. If the denial was for eligibility and you think your child should have been eligible, the reason is incredibly important. For example, perhaps the eligibility was determined using the standard Medicaid eligibility and not TEFRA. You were trying to apply through a TEFRA program. Sometimes the notice you get isn't truly a denial, but really rather a request for additional information. If it was a denial of coverage, sometimes it's due to an error in the submission, but it could also be that the request didn't appear to meet medical necessity or some other reason. In any of these cases, make sure you follow up with the ordering provider. They already may have started taking some steps to act on your child's behalf to appeal. Next, follow the appeal process. Look at that process, paying attention to timeframes. A fair hearing is Medicaid's formal appeal process, and this process includes a hearing and then a subsequent decision. And I'll go into that a bit more on the next slide. If Medicaid is through managed care, you typically need to go through their internal appeals process before requesting a fair hearing with Medicaid. And lastly, don't throw anything away. I'm a big believer in keep it, you might need it later. Do not throw it away. We do get a lot of requests on the fair hearing, what the process looks like to apply, and then what happens at the fair hearing. So you get a denial, you read it, you want to appeal it. So the beneficiary or representative can request a fair hearing in person, online, telephone, or via mail. It really depends on what state you're in and what their preference is for how you apply for one. A form for requesting the hearing should accompany the decision that you would receive from Medicaid. If not, that form's usually online or there's a phone number to call. The forms do look different from state to state. And the fair hearing itself is usually with the state's hearing and appeals bureau, but a state could delegate this to another appeals entity. They also have to permit expedited appeals, so that's when the need is critical. So the state will determine if the request meets the criteria for that expedited appeal. They'll look at it and see if waiting for a standard resolution could seriously jeopardize the person's life, physical or mental health, or ability to attain, maintain, or regain maximum function. So once that's submitted, you get a written notice that a hearing is scheduled. If the hearing is scheduled, I do want to mention that it doesn't necessarily mean that Medicaid can't change their mind and decide to go ahead and cover something before the hearing arrives. And then in that case, it's pretty easy. You'll be notified, and at that point, you can drop your appeal or your case. So then the hearing is held as scheduled. After the hearing, the appeal is resolved within 90 days, and states can have their own time frame for requests, but it can't be more than 90 days. And then for expedited appeals, 3 working days is the turnaround time for decisions. And once you receive a decision, that decision should be in writing. So what happens at this fair hearing? Because it's a big question we get often. And, you know, it can be overwhelming to go through this appeal process. What happens? Often it can be a very relaxed type atmosphere, but it isn't always. Sometimes they occur via phone. People that are present, in addition to the hearing officer, there are 2 parties in the case, the person or the representative appealing the decision, or the appellant, and Medicaid staff. Other representatives or witnesses for the beneficiary or Medicaid could also be present. There's also a chance that Medicaid might just send some documents, written testimony, and no staff. You should be prepared for the hearing to be recorded. And then there is a swearing in process. There's a testimony where each person is able to give their testimony. And then after the testimony, there's a Q&A process. It's very similar to what you think about when you think about a cross-examination, but not nearly as, I guess, severe. So a person can ask questions of the other side. The hearing officer can ask questions. You also have the opportunity to comment on testimony that was provided by others. So let's say somebody from Medicaid says something that's just completely untrue. You can dispute it at that point. And then after that, the administrative law closes the hearing and explains the next steps, including the timeframes for the decision, which could be several weeks. And then the written decision should arrive in your mailbox, either for or against. So what if your child still needs some healthcare coverage and Medicaid isn't an option and you don't have commercial coverage? There are a few options. First is looking into CHIP, or the Children's Health Insurance Program. And this is a health insurance coverage in families that earn too much money to qualify for Medicaid. And it provides coverage for children and sometimes pregnant women. The states do determine financial eligibility, and some charge premiums. For those that charge a monthly premium, it shouldn't be more than 5% of the family's annual income. The next is Title V funding programs. And this is, again, based on what state you live in. Some states use their Title V program money to support children with special healthcare needs and help with treatments and things like that. Others use it for case management programs for children at risk and some other items. So, it really depends on where you live. And then the next option would be the marketplace plans, healthcare.gov, which I'm sure most of you are familiar with. The commercials have been all over TV right now. Either federal or the state has its own, and you could possibly get some subsidies to make the payment. Where might you get some information specifically for you? The first is social workers or medical staff where your child receives care. They could be excellent sources of information, especially if the medical facility you go to is in the state that you reside. If they don't have answers to the questions you have, often they might know who to send you to. Next would be other families who have navigated the systems. They can be a good support. And this is really particularly true if they live in the same area of a state. But I also realize that given how rare Dravet is, there may not be others near you. My understanding is that DSF does have a family network and private support groups, so they would be excellent resources. There's the state's Medicaid or Department of Human Services website that could include some details on programs available. A group called Family Voices, which is a national organization and grassroots network of families and friends of children and youth with special healthcare needs and disabilities that promotes partnership with families to improve healthcare services and policies for children. And last, but certainly not least, because this is actually one of my favorite resources to send families to, is kidswaivers.org. And this is for families to use this information for their own personal use. It's a research project by a woman named Susan Agarwal, PhD. And this program or website, actually you can search for specific states, you can compare states, and you can find out what HCBS waivers are available, if the state has a TEFRA program, links for how to apply for those, Title V programs, and also one of their most recent ads is if there's a paid family caregiving programs. And that's something I know a lot of families are trying to find information on, especially right now. Okay, on to questions.
All right, Amy, thank you for that. Yeah, we do have a couple questions here. First one we have, any pointers on how to move to the front of the line on your state's wait list if your child is not doing well? So like
Okay.
an emergency type of situation or anything in that effect?
So this is another case where it has to do with the state that you reside in. Like I said, sometimes it's a numbers game, but there are a lot of states who have it based on criteria as far as how urgent the need is. You'll find pretty typically in a lot of states they'll have categories like is it an emergency need? Is it a planning need? Is it a critical need, which means it's coming up but it's not here yet? Other states, numbers game, complete numbers game. So it really, it's so variable based on where you're at.
Yeah, that's true. Okay, the next one we have. Where can I find a list of states that don't have a wait list for services?
Well, the Kids Waivers program actually lists where that kidswaivers.org that I had referred to actually lists on their site what the wait list looks like. So one could go there and, look and see what it looks like. And also, there are some waivers that don't have wait lists in certain areas. So,
All right. My son, age 14, finally made it off the wait list in our state for the waiver program. Now we might be moving for my husband's job. Will we have to start over on a new wait list in the new state or will the approval transfer to the state?
it does not transfer, unfortunately. So they'll have to start over. If you move and you're still in state, that's a different scenario. But if you move to another state, yeah, you're going to be starting over, unfortunately.
That's a bummer.
Yeah. I mean, you might do some, planning in advance. One could call the agency in the area that you're moving to and just kind of give them the heads up that you're coming. And this is what you're dealing with, and these are the needs. And they, might hurry up and get that process of eligibility going quicker.
Sure. What is the difference between a Katie Beckett waiver and a home and community-based waiver? Another parent told me to apply for Katie Beckett, but that is not available in my state.
Usually Katie Beckett, in most cases, will be that Medicaid coverage, not necessarily those additional services that are offered. Even though, under the caveat, there are some Katie Beckett's that do offer some very limited services in addition to Medicaid, but that is not the norm.
Let's see. Does your child need to be a certain age to qualify for a waiver program?
It depends on the waiver. I mean, unfortunately, it depends is my standard response. And that's, I think, what makes it so hard for families to navigate these, because there's so many different rules or are different ways of qualifying, based on what you're looking at, the eligibility criteria, the age group that's going to be being served. Sometimes it's 0 to 99, sometimes it's 3+.
Right.
Mhm.
Here's an interesting one. My son was on a waiver program in Texas and was removed because he hadn't had a seizure in over a year. He has significant developmental delays, other health issues that put him at risk, and needs regular therapies. I don't feel like those making the decision understand the severity and evolution of Dravet syndrome. Do you have any suggestions on anything we can do to get the decision reversed on appeal?
Well, definitely apply for that appeal if you're still within the time frame.
Yeah, I know. I personally had we had to appeal, and it was a little scary at first, but once we called, it was actually taken care of on the pre-hearing, so we didn't even get to a full-on hearing. So that
So
was kind of a
sometimes they
relief.
change their mind, right? In waiver
That's right.
programs, just like in Medicaid itself can change their mind or say we've gotten new data. we're going to, do this reconsideration right now, and we're going to skip the hearing because we're reversing our decision. And that's a great day.
Yes. Okay, let's see, we have another one here. We live in California. My son is 39 years old. He has Medicare, Medi-Cal. He has been receiving PT hippotherapy since July of 22. Medicare has paid part. I have been told by Center for Healthcare Rights that Medi-Cal now managed care, LA Care, that Medi-Cal won't pay anything. It does seem that Medicare paid only a limited number of visits. What do you advise?
That's a tough one without knowing really all the details surrounding the ask. So, I mean, I'd be, happy, to get more detail. I could follow up.
Okay.
Sure.
Yeah, that might be a good one. I can reach out to this individual and maybe get a little more detail and maybe get you two connected. Okay. Let's see. Familiar. I think that's what we've got for questions, unless is there anything else that you would like to bring up, Amy?
I don't think so. I just want to, thanks everyone for your time and your attention, and I hope this was valuable for you. And happy to have been here.
Yeah, for sure. Thank you so much. Yeah.
Oh, sorry, I was just going to catch you. I don't know if you noticed there were some other questions after that first question from Georgia. There's a question 2 and 3 that you might want to give Amy really quick.
Oh, he's on a waiting list. Let's see. Advise. Okay. Yes. So so number 2, he is on a waiting list for HCBA, personal care services. He has nursing needs more at some time other than other times. Do you have any advice on how to get these services in a faster way, or is it just first come, first served?
I know HCBA right now is dealing with a huge influx, and they're not, I think right now, unless it's changed, everybody's sitting on a waiting list right now, or at least that's what I've heard through the grapevine. Whether that's changed recently, I don't know, but that's my understanding, at least at present. And then children are taking priority once they do have some vacancy. So they're looking at those under 18 folks.
And is there somebody that it's difficult to know who to contact? So if you have any questions, is there a general contact or somebody you can reach out to ask those questions, whether you're in the process of or starting the process?
If they want to ask questions of me, that's absolutely fine. My email is amy@littleherculesfoundation.org. I'm happy to answer if I can. If not, I'm happy to try and point you in the right direction for who you might be able to get answers to your questions from, specific to your area.
And what is the general time frame for an appeal?
Like I said, it has to be resolved within that 90-day period, but states can have their own rules, which could be less than that, but it can't be more than 90 days to resolve the appeal once you applied. So you do have some time to to put that, you have some time to submit your request for a fair hearing.
Here's another question that just popped in. Is there a statute on the appeal?
There is, it's a federal statute, it's a CFR. I'm not gonna remember the numbers. It's in the Federal Register though, and I actually had put it on one of my slides. If someone actually wanted to go look at the appeals information with fair hearing, it's the let's see, 42.438.410, I believe, if I'm reading my slide correctly. And I can also send a link. If you wanted to send that out, Rich, you could do that.
Okay. Very good.
Actually read the statute.
All right. Well, I think that'll wrap it up. Amy, thank you so much for taking the time to talk to us about that.
Thank you for having me. I very appreciate it.
Yeah, I'd like to thank Marianne as well for making the time to join us, DSF Executive Director, and Amy, thank you so much. We'll get all of this wrapped up and get posted on our website. So for those of you who want to review it again, we can. Again, I'd like to take a minute to thank all of our sponsors, Biocodex, Jazz Pharmaceuticals, Takeda, UCB. Thank you so much. We really appreciate. And thank you guys for taking the time to join us with this session.
Goodbye, everyone.
Okay, thank you. Goodbye.
Thank you.